that is tachycardia, and another one is bradycardia. Right, coming to the tachycardia, the term tachycardia, which usually is defined as faster than 100 beats per minute in an adult. Suppose in resting stage, normal heart rate is around 72 beats per minute. But if in any adults, if the resting heart rate is more than 100 beats per minute, then we term it as tachycardia. So, coming to the causes, what are the causes of tachycardia? The most common cause is increased body temperature. For example, when we get fever, the heart rate increases, right? It increases because of increase in metabolism in our body, which the metabolism in the sinus node also increases, which in turn leads to more excitability of the SA node, which leads to increase in heart rate. Okay, and the second one is dehydration. So what happens actually in dehydration? There is a loss of fluid in our body. So to compensate the loss of fluid in our body, so why to compensate when there is a loss of fluid in our body? When there is a loss of fluid in our body, there will be a drop in blood pressure. When there is a drop in blood pressure, further drop may cause syncope, or it may lead to coma, or it may eventually lead to death. So to prevent the fluid loss in case of dehydration, such as for example in sunstroke, the heart will try to pump more blood by increasing rate of the heart rate. Okay, so in dehydration, what happens? Automatically the sympathetic nervous system will get activated and the heartbeat will be increased, so that is to maintain the required output of the blood to supply to all parts of the body. So that is the main cause of increase in heart rate in cases of dehydration. Coming to blood loss and anemia, see, these two are all the same. In blood loss, what will happen? There will be a severe hypovolemia. When there is hypovolemia, what is hypovolemia? Loss of blood. Okay, will leads to decrease in the quantity of blood, which is called hypovolemic. Okay, that is volemic means what? Decrease in volume of the blood, which is called as hypovolemia. In hypovolemia also, what will happen? Sufficient amount of blood is not present. So when sufficient amount of blood is not present, what will happen? The organs in our body will not receive sufficient quantity of blood for their normal function. At that time, what will happen? We may get dizziness, sometimes syncope, or we may lead to coma. So to prevent that, heart sympathetic nervous system will get excited and it will increase the rate of the heartbeat to prevent us from falling down or prevent us from syncope. Okay, right. See, stimulation of the heart by sympathetic nerves will happen. Okay, and what are these other conditions which will also leads to stimulation of the heart by sympathetic nerves? Toxic conditions of the heart. Some of the toxic conditions of the heart also will leads to this. Okay, the heart rate usually increases about 10 beats per minute for each degree Fahrenheit increase in body temperature. This is a very important bit. Heart rate usually increases for how many beats per minute? 10 beats per minute for each degree of Fahrenheit increase in body temperature. Understand? And with an increase of 18 beats per minute for each degree of Celsius. If it comes to Celsius unit, the heart rate increases to 18 beats. Whereas in case of Fahrenheit units, the heart rate increases to 10 beats per minute. Okay, up to a body temperature of about 105 or 40.5 degrees centigrade. Okay, beyond this, the heart rate may decrease because of progressive debility of the heart muscle as a result of fever. So beyond this also, we expect the heart rate to increase? No, it won't increase. Why? Because the heart muscle will get debilitated due to high fever, due to some chemical reactions, which further will leads to decrease in the heart rate. Okay, this is what I want to say. Okay, so coming to the tachycardia, term tachycardia, which usually is defined as faster beats than 100 beats per minute in an adult, a resting phase. What are the most important causes of tachycardia? Increase in body temperature, dehydration, blood loss, anemia, or any hypovolemic shock. And it also due to stimulation of heart by the sympathetic nerves, which include some toxic conditions of the heart. Okay. Next, bradycardia. This is quite opposite to the tachycardia. The term bradycardia means slow heart rate, usually defined as less than 60 beats per minute. So here the heart rate should be less than 60 beats per minute in resting phase. It's termed as bradycardia. Okay. So here the common question they will ask either in Viva or in any competitive exam in why there is bradycardia in athletes at a resting phase also. Okay, for this we need to understand this small concept. The well-trained athlete's heart is often larger and considerably stronger than that of normal person. What does an athlete do? He run, right? So continuous running will make his heart to become more larger. I mean, the size of the heart in athletes is larger, and also the contractility is also stronger than that of the normal person. Okay, so due to this increase in size and also the stronger contractility, it allows the athlete's heart to pump a large stroke volume output per beat. This is important. This allows the athlete heart to pump a large stroke volume output per beat. Okay, so per beat the stroke volume is increased. Understand? In athletes, that occurs even during periods of rest. Okay, so when the athlete is at rest, increased quantities of blood pumped into the heart arterial tree with each beat initiate feedback circulatory reflexes or other effects that cause bradycardia. So even in the rest also, due to larger in size of the heart and also increase in contractility force of the heart, large amount of blood is pumped out for each stroke volume per beat. So when there is sufficient amount of blood is pumping into the heart, automatically some feedback reflex will cause and it leads to this feedback reflex will cause and activates parasympathetic system, and it leads to decrease in the rate of the heart, which will be less than the normal, that may be around 60 beats per minute. So in athletes, even in resting phase also, their heart rate is less than 60. Understand? So in athletes we call their heart is in bradycardia, and it is very normal in them. It is not due to any other disease of the heart. Okay, due to the feedback mechanism by the parasympathetic system, which activates, okay, will lead the vagus nerve get activated, and this vagus nerve will cause the decrease in heart rate. Understand? Because sufficient amount of blood is already pumped into the body, right? See, vagal stimulation causes bradycardia. Any circulatory reflex that stimulates the vagus nerve causes release of acetylcholine at the vagal endings in the heart, resulting in parasympathetic effect. That's what. So vagal stimulation occurs. Vagal stimulation causes the release of acetylcholine. This acetylcholine will cause a decrease in the heart rate. Okay. Perhaps the most striking example of this phenomenon occurs in patients with carotid sinus rhythm syndrome. So another one, this is very important, but this phenomenon also occurs in carotid sinus syndrome. What is this carotid sinus syndrome? There are some pressure receptors present in the carotid sinus region of the carotid artery walls. Okay, on the neck, lateral side of the neck, we have a carotid artery. Okay, on the carotid artery, there present some receptors which are called pressure receptors, or also called as baroreceptors. Okay, it is in the carotid sinus region of the carotid artery. Okay, and these baroreceptors are excessively sensitive. Understand? Remember this. So even a mild external pressure on the neck elicits a strong baroreceptor reflex, causing intense vagal acetylcholine effects on the heart, including extreme bradycardia. Some of this reflex is powerful. It actually stops the heart for 5 to 10 seconds, leading to loss of consciousness or syncope. In movies, we see when heroes will come and tap on the side of the neck, suddenly the villains will lose their consciousness and they fall down. How is it occurring? It is not any magic. It is due to the excessive stimulation of these baroreceptors present in the carotid sinus region, in the carotid artery in the side of the neck will get activated, which leads to excitation of vagal, that is parasympathetic nervous system, which leads to decrease in heart rate, which may be extreme, and sometimes the heart may stop for 5 to 10 seconds, leading to loss of consciousness or syncope. This is called carotid sinus syndrome. What is it? Carotid sinus syndrome. So what will happen in carotid sinus syndrome? Which nervous system will get activated? Means what you have to say? Parasympathetic nervous system will get activated, and it stimulates the vagus nerve, release of acetylcholine, the windings of the heart, which leads to decrease in the heart rate, as I say note, which will also block the heart for 5 to 10 seconds, and it leads to syncope. Understand? So here we have to remember the carotid sinus syndrome and also the bradycardia in athletes. These two are due to activation of parasympathetic nervous system. Okay, right. Thank you for listening.